Good day, everyone. Thank you so much for joining us for a show. And today we'll be focusing on winter wellness. My name is Dr. Siviwe Mila, and I'm a health expert and also very passionate about awareness when it comes to our population. So many times people think, does really cold weather cause flu or the common cold? And a simple short answer is no, not the cold weather. However, weather does contribute in us getting common flu and cold. Flu and cold is caused by what we call viruses. However, in winter, the weather and the conditions around winter make it easy for the viruses to easily spread. This means more people are staying indoors and there's poor ventilation, doors not being open, windows not being open because it's cold. And also in winter, we tend to be in closer contact with each other than we would in summer. And hence, if someone is suffering from something, they can easily spread it by either coughing, sneezing, or just touching someone that has had a viral infection. Another phenomenon that people tend to ask us is, can taking large amounts of vitamin C actually prevent you from getting sick? And also, this is one of the most common myths that we understand and we hear. However, we work on what we call evidence-based medicine. And what is actually the science saying? The current evidence shows that vitamin C does not prevent colds in most people. However, it does assist in terms of strengthening the immune system. Regular supplementation may reduce the duration of symptoms, usually by a day or so. So meaning that you will have the chance of still getting the symptoms, it doesn't prevent. However, you do have what we call vaccinations with help with preventing of flus because it's a virus, as I said earlier on. As a health professional, if there's one winter myth that I would like to literally retire forever, it is the myth that antibiotics cure flu. As said earlier on, that flu or common cold is caused by viruses. Therefore, using an antibiotic for a virus doesn't help. Antibiotics are used to treat bacterial infections, and these can be received in the body by various means. However, though, if you take antibiotics unnecessarily, you do not help the virus because virus is self-limiting infections, meaning that you will get better by yourself with enough water, enough rest, and just making sure the body is given enough time to recoup itself, you get better from the virus. Antibiotics can cause you to have side effects, unnecessary side effects, especially if you're taking it unnecessarily. Also, it contributes to what we call antibiotic resistance. This is when you have been using antibiotics so much in your life that when you need them, when the body needs them because it's picked up a bacterial infection, they no longer work because they are so used to your body. Your body has become resistant to important antibiotics. Most of the times, people will come into the practice and say, Doc, I've got this bad flu, I need antibiotics, I'm going to be fine. That is a common myth that we would like to dispel and retire forever as professionals. So only take antibiotics when prescribed by a healthcare professional, and if there is a need for those to be prescribed to you. Many of the times we get questions like, why does it seem like everyone gets sick during winter? Is the weather really to blame? So one can say that the winter is like a perfect storm. So when you're indoors and there are gatherings, you've got less ventilation, like you won't have doors open like right now because it's a bit cold. There is less circulating of the air. And more respiratory virus then tends to circulate, especially if you're a lot of people, be it in an office setting, even if it's open plan. And the lower humidity allows for viruses to survive longer. The biggest mistakes that people generally make when they're trying to be healthy during winter is that they go to work or school while they're sick. You know, the child comes from school only one day and you're like, go back to school because there's no one either to look after you. I'm like, my school fees is just going free. But we don't let people fully recover. Not washing your hands more frequently, shaking people's hands, especially after the COVID era where we used to do more the elbow greeting. Now, if you're passing certain documents, we're passing certain things, they're exchanging, but we're not washing our hands much more frequently. And viruses tend to spread by me touching my nose, then we're shaking someone's hand, and then they rub their face, and it's easily there now for that virus to get into the next person. Ignoring coughing etiquette. A lot of people, sprays out there, and the virus can. COVID, we were having etiquettes about coughing. You cough in your elbow, even coughing on a tissue, throwing it away and washing your hands. That somehow we have forgotten that hygiene and etiquette when it comes to coughing. This one I'm also guilty of. Drinking too little water. So every day, at least we should try and aim for 2 liters of water. For patients that have got heart problems, that could be a bit less because we don't want them to retain or keep the water in their bodies. But generally, for a healthy individual, 2 liters of water is sufficient. Generally in winter, we do not want to drink because it's cold. We want something warm, and the water can be warm. It does not necessarily have to be cold water or room temperature water, but just making sure that we consume enough water is sufficient. As health professionals, we get asked, are there foods that genuinely strengthen the immune system? The simple answer is to say there's not one superfood. Imagine if there is, we would all want to eat that superfood, right? However, your immune system works best when your overall nutrition is good. Make sure that your plate is covered by a handful of starch and also 1 portion of meat, and the biggest portion should be vegetables and fruit. Whole grains are another one, and this becomes important for the gut health. Nutrients that are important to focus on during winter are the following, and these are key nutrients to include: your vitamin C, vitamin D, zinc, iron, and protein. These foods and these nutrients are generally found in your normal day-to-day foods. If your doctor finds that you still have a deficiency despite the food that we eat, then it is important that you take supplements for those. So people will say, Doc, you say we must recover, must take time off, but when do you know when to stop treating yourself at home and come see a doctor? And this is a generally very good question, because we tend to see people coming later on at the hospital and they said, no, I thought you were going to get better. I thought it was going to get better, or he was going to get better. And you find that the condition has deteriorated. So seek medical attention if you're experiencing fever that is lasting more than 3 days, difficulty breathing, and you just feel like you're out of breath, you cannot breathe, or it feels like something, an elephant is sitting on top of your chest, any sort of chest pains, confusion when you are asking someone, do they know their name, or they start just having so much confusion that it is not in keeping with their normal selves, severe dehydration. This is to a point where people are having diarrhea, or they're even sweating so much and not taking in fluids to replace, and therefore they end up being weak and dehydrated. Symptoms that improve then suddenly get worse. So if you feel like, no, I was feeling better, then you just take a dip for the worst. Please contact your doctor. Also, persistent coughs that are lasting for weeks. In a country like South Africa, where we have TB as one of the biggest contributors to our health, I think post-COVID, we're not being giving enough awareness about TB, which is tuberculosis. When you're talking about children, the moment a child has got difficulty breathing, they're not eating well, even if it's small children that are being breastfed, extreme sleepiness, and also persistent high fevers that do not break by paracetamol. Blue lips is a big sign. Make sure you rush to the hospital immediately, because this means that the child is not getting enough oxygen. Signs of dehydration, and that is when you look at the child, they're feeling all boggy and tired. Their eyes look like they're falling to the back because of what we call sunken eyes. And if you touch the skin stays tinted, meaning it looks like the pinch stays stronger. And also for kids that are still on wearing nappies, if there are fewer nappies that you change, if you know that your child generally uses 6 nappies a day and suddenly they're only using 2, then there's cause to worry. So people will say, Doc, what is the everyday habits that unknowingly increase our risk of getting flu and common colds? And one always says that the common habits include touching one's face frequently, and especially after touching other people, not washing your hands is frequent enough. And also with washing your hands, at least making sure you wash your hands for 30 seconds. So you wash inside and make sure that you go into the barrows, you wash your palms and all the way to the wrist. We tend to just want to wash the fingertips and not wash all the hands. Sharing drinks or using utensils, especially with people that are still having a cold or virus or flu. As we're coming to the end of our segment today, if viewers can remember one thing from today, this would be it. My message to you is simple. You don't need expensive supplements or miracle remedies to stay healthy this winter. Good sleep, which is between 7 to 9 hours, a balanced diet, regular exercise, at least 30 minutes every day, hand hygiene, making sure you wash your hands, and staying home if you're sick, and making sure that you are getting vaccinated and your vaccinations are up to date to remain most effective in the way of protecting yourself and those around you. And also, antibiotics do not cure flu. Thank you so much.